patients that we're seeing that present to the hospital have a very, very typical story, which to some extent makes our life a bit easier because this new disease seems to, in most cases, affect people quite similarly, at least at first. So there's a very, very typical story of people with sort of a dry cough and feeling fairly exhausted, although obviously we do know that a large proportion of people that catch this virus may not have had any symptoms at all. But the people that present to the hospital have a consistent story of a cough and worsening shortness of breath and breathing quickly. And they come to us in the intensive care unit when that breathing is becoming a problem and when they're struggling to get enough oxygen into their systems, and we have various ways of helping them do that. And the first of those is just giving them some extra oxygen to breathe.
Okay, so what proportion of patients end up in intensive care?
Well, the vast majority of people have no symptoms or very mild symptoms, but we think probably about 5% of the total number of people who get this nasty virus need intensive care. And of those, only a proportion of those actually need to be intubated and put on life support. And certainly in this centre, we're trying to reserve that as something of a last resort, and only doing it with people who are really struggling with their breathing. So about 5% overall need some help with their breathing.
And how does it escalate? How do you find it escalates?
Worsening breathlessness. So we have tests we can do to see how much oxygen is getting into the system when people are breathing. And that tends to drift downwards. So the amount of oxygen getting into people's system does get lower and lower. And that's accompanied normally by a feeling of being quite breathless. Although in some cases people can have quite alarmingly low oxygen levels in them and it not seem to bother them very much. So there's a variation in people's response, but the universal characteristic that brings them to intensive care is not enough oxygen getting into their system through their lungs.
And what type of treatment would they receive?
Stepwise, we start off with giving people more oxygen. We don't have much in the way of medicines to make people better. Nearly everything we're doing is just supportive and trying to keep them going while they get better on their own. But initially, we give people extra oxygen, and then we can give them oxygen with tight-fitting masks so it sort of pushes the oxygen into their lungs a bit harder and can help with their breathing. And if that's not enough, then we can put a tube down into their trachea, into their windpipe, and take over their breathing. And the hope is that rests their lungs and we can keep the oxygen getting into them long enough for them to get better. Although in some cases we think that that process is quite risky. So we're rather reserving it for when we absolutely have to nowadays.
And what are these risk factors?
Well, it's when you get this virus and if you get sick enough with it, your lungs are quite inflamed and swollen, and they're struggling to do their job, which is gas exchange. And putting this tube into the windpipe, while it might help in some ways, it comes with a price and it can be detrimental in others. So while we're still doing it, and it does seem to work most of the time, and most patients that get intubated get better again, those patients that sadly don't survive are usually, so the ones who've come to intensive care, are usually dying having been intubated.
And what's the risk factor in proportion when it comes to men and women?
We're seeing much more men than women being affected badly by this virus, and not particularly elderly, although the very elderly patients we're probably not seeing in the intensive care unit. Myself and my colleagues have some ideas about which patients are likely to survive a spell on the intensive care unit, and sadly people who are extremely old are very unlikely to do that. So most of our patients are not very old, they're in their 50s and 60s, mostly men, and quite a lot of them have had pre-existing conditions like high blood pressure or diabetes.
Are you expecting a vaccine to come anytime soon?
No, we're not expecting any magic cure to come in any short period of time. The treatment will continue to be supportive for some time. There may be some medicines coming through trials and research ongoing that prove to be helpful, but there's nothing absolutely certain along those lines yet. And the most useful treatment that's likely, or treatment is sort of the right word, that's likely to appear in the next few months or year or so would be a vaccine, which would definitely be a big step in the right direction. But in terms of drugs that treat the virus, There are several candidates, but nothing so far that's really proven to be effective.
So what are the issues with producing a vaccine so quickly?
Well, there's all sorts of great ideas about how we can get various types of vaccine as we speak. But because vaccines have to be given to so many people to be effective, they have to also be incredibly safe. And you can't have the vaccine hurting a proportion of the people you give it to, because that may end up being more people than were hurt by the virus itself. So vaccines have to go through incredibly rigorous testing before they can be used on a population basis. And so they have to be very, very safe, and that takes time.
So that brings up the issue of testing. There seems to be delays with getting tests and producing tests for people.
We're big fans of testing here, and I think most doctors are. We've managed to do some tests here. We find it very informative. The more tests, the more information you've got, and the better you can manage your resources, and the better you can look after your patients. Testing is incredibly useful. I think part of the problem is that the tests are not perfect. And while we can manage in this hospital having a test that might be about 90% correct, if you roll that out across millions of people in a population, that means you get a huge number of people who've had the wrong result to their test. And so you can see why the government is a bit slow in rolling out what they perceive to be a good test, but they're hoping for something better. Whether or not something better comes along remains to be seen. But I have some sympathy for the government in trying to find the most accurate tests. But I do think we could be doing a lot more testing. It's certainly been effective in some other countries. And most doctors, I think, feel that more testing the better and bring it on. But it's certainly the case we could have done more earlier here. But I have some sympathy as to why sorting it out has been tricky.
The public hear a lot about testing all the time, but what does it actually involve?
So there's two types of tests. There's one that tells you if you've got the virus, and that's the swab where they stick a little bit of cotton wool sort of on a stick in your mouth and in your nose. And that will tell you if you've got the virus then. And that's very informative and very helpful. Most of us would prefer to have the other test, which is using a drop of blood, which tells you if you've had the virus at some point in the past. And most importantly, we think that means you're very unlikely to get the virus again, at least in the short term. So if you've had the virus in the last couple of months, you then can return to the workplace. You're probably not as infectious, and you're probably not going to get ill again. And that then enables manpower planning and people to, get the country going again. If we know that people have had the virus and are not necessarily completely immune, but are at much, much reduced risk of getting ill again.
And the tragic side of this is obviously the death rates. What are you seeing here in Lewisham's intensive care unit?
Well, it's impossible to say what the overall death rate is, because the numbers that we see published are not the whole story. So you have to take all of those with a pinch of salt. The death rate of patients that come to intensive care that go on life support remains quite high. It varies a little around different centres, but certainly if you need to be intubated and go on life support for this virus, you're at risk of not surviving. Having said that, again, without going into specifics, even in that situation, the majority of people, so more likely than not, will recover. So it's not a death sentence, but it's not odds that you would like to take unless you had to. Overall, nationally, it's very difficult to say what the death rate is because of this lack of testing. We don't know how many people in the country have had the virus, and we actually don't really know how many people in this country are dying of the virus. So everything is a fairly crude estimate. I think later on in the future we'll have a better idea of what happened, but at the moment knowing what's happening is a guess. I think probably the number of people dying of this virus compared to the number of people who've had it is going to be quite low. A lot of people have had it without even knowing, but we don't know what that proportion is at the moment, and it's anyone's guess, and you hear lots of people saying lots of different numbers, and I'm not sure which one's correct.
A lot of unknowns.
Enormous number, yeah.
How does this affect you personally?
It's been hard work for the last month, challenging in a number of ways, but completely unprecedented. But we're surrounded by a really excellent team of doctors and nurses, incredibly lucky with the team we've had. The support around the hospital and from the local community has been absolutely fantastic and humbling. And it's been a privilege to be part of the attempt to manage this horrible virus that's caught everyone by surprise. But the response from the NHS as a whole and from this part of London and this hospital has been magnificent. And as I say, it's a privilege to be part of it.
And your staff, how are they coping?
They're coping extremely well. We've spent a lot of time and paid a lot of attention to looking after them and making sure that they feel safe and valued. There have been some people who've been distressed temporarily, but on the whole, that's all. And we've only had about 3 people who've been ill with the virus, and they've all made a full recovery. And that's helped morale as well, because it's nice to see that the people we know and work with who've been affected have got better. So on the whole, psychologically and morale-wise, everyone's doing really well.
And how skilled are your staff dealing with this pandemic?
They were good, and they've of necessity got better. So in the last month, everyone has stepped up. And the people are in unfamiliar roles, they're working longer hours, they're putting on all this safety equipment, they're learning new skills, and almost without exception, everyone's been fantastic. It will be a time that people, I think, look back on with some pride as well as sadness. And there are a lot of positive things that have come out of this tragedy as well. And the NHS will be a better service because of this. A lot of lessons have been learned.
Public have heard about the delays in getting PPE, the safety masks and safety gear. How are you coping with this?
It has been difficult, and with a few days where it was getting a bit touchy, on the whole we've had just enough, and we're now getting more smoother supply routes, and I think most people would say they have sufficient PPE and feel safe. Earlier on it was a bit close occasionally, but as I say, we've been testing our staff, and in fact quite a large proportion of our staff working in the intensive care unit, surrounded by people very sick with COVID, haven't contracted it and are still testing negative and have had the blood test to say, have you ever had it? And they haven't. So that means that our PPE, I think, has been effective. So yes, I think our staff feel safe. I hope so. A lot of effort and a lot of effort's been put into their mental well-being and their sort of sustainability in the face of what's been a prolonged, difficult time.
You spoke earlier about support. Well, how are the general public adding to this support?
On the whole, magnificently. I mean, it's been really, really touching to see how the appreciation for the hard work at the front line being shown by the huge majority of the population. Most people are being very sensible. Most people are behaving amazingly gratefully, and it's very humbling. So with minimal exceptions, I think the response from the whole country has actually been quite impressive. And it seems to be working. The numbers we're seeing, certainly in this part of London, are encouraging in terms of how many new people are developing the virus, and we're hoping that things might be flattening off a bit. I don't want to tempt fate, but we still have plenty of capacity and we can respond to more patients. But the last few days might point towards things slowing down a bit, and that would be great.
And that brings us to the strategy of the government.
I think
what
they've
are your
been.
comments on this?
It's impossible to get it right, and it's easy in hindsight for everyone to criticise what they've done. On the whole, I think they've been roughly on the right lines. That's just my opinion, and I think the closing things down when they did, we seem to be seeing the benefits of that now, and we're not seeing quite the number of people coming through the emergency department that we were seeing 10 days ago.
Can you tell us a little bit about your infrastructure? How are you coping with space and beds and things like this?
I think everyone's having to be quite creative and innovative. No hospitals were spec'd for every patient in the hospital to be on huge amounts of oxygen. So it's understandable that that sort of thing has been challenging. Most places have found solutions, and we have here, but it has been an issue. The infrastructure has been stretched absolutely to the maximum by this, as well as staffing. So we probably, the single thing we've done to mitigate against that, hospitals that have been really, really full and struggling have been transferring their sick patients to other hospitals that have got a bit of space, and those flows around London have taken the pressure off the hotspots, and as things have evolved, those hotspots have moved, and we've moved patients accordingly. So a couple of weeks ago we were sending a lot of patients out from this hospital, whereas today we're taking a few back in again, and we're happy to do that because we've now got some space, and that will continue for as long as it needs to.
The team at Eman Channel and Saffron Kitchen have been delivering food to many hospitals, including yours here at Lewisham. How does that build morale and push the NHS staff forward?
It's absolutely fantastic. It's been, it's made such a difference. Just the quite simple fact of having delicious, nice food delivered, which is wonderful because we can't actually really get it anywhere else. So it's not just the kindness and the thoughtfulness and how much we appreciate people thinking about us. It's actually that the food is really helpful and it's kept people going. So both the thought behind it and the actual food itself has been completely invaluable and has massively helped us do our jobs in the last few weeks.
What are the lasting effects that we're going to have from this pandemic?
Well, it's impossible to say. I think the near future things will look a bit as they do now for some time. I think we've got a few more weeks of this to go. The far future, I think the health service and society might look quite different to before COVID came along. I'm not quite sure how, but I think this has been quite a wake-up call for the world. I hope in a good way. There are enormous tragedies that have come about because of this, but there will be some positive things too, societally and in terms of how we look after poorly people. So I'd like to think that there will be positives, but the main thing people will look back on will be the number of terribly sad stories and people that lost their lives early, and that will remain the case, and it will be a time that people look back on in sadness.
From yourself, who's on the front line, some advice to the general public.
The main thing is don't worry too much. Most people won't get this. The people that do, most of them will be fine. So I think fear isn't helpful, but common sense and pragmatic approach to avoiding close contact with other people has made a difference. Avoiding large groups of people, this thing likes large groups of people. And stopping that happening has definitely saved lives. And that may need to continue a bit longer than is comfortable. And people might feel, oh, we're through this now, why can't we go back to normal? We'll probably have to accept that normality will need to be put on hold for a bit longer than most people would like, but the benefits will be there, and the benefits will outweigh the pain.
And finally, how are you and your family?
That's very kind. I'm absolutely fine. My family are all absolutely fine, although I haven't seen my youngest children for a month, and I'm looking forward to seeing them back next time.